it is going to be one of the extremely helpful things about the standards being overarching,
Yeah.
right across support provision, health, social work, the whole sector, because it'll have us all talking exactly the same
Yeah,
language, working
absolutely.
towards the same standards and principles. So I think it is going to really change the conversations between people across our range of services.
I think it feels much more like a common approach.
We're reviewing all our policy and procedures, which is probably easier for a small organisation rather than a big council like yourself, where we're actually looking at all the policies and procedures and make sure they are aligned with the main principles of the standards and also the values of the standards. So we're looking at that and really checking that they're all consistent and they all marry up, and so that's a big work at the moment. So that's going to affect the workforce totally.
I think as well it feels a lot less like a set of rules giving us permission to do things in the way that we've been aiming to do them, but that things are starting to align now. So in terms of being really outcomes focused, being a rights-based approach in terms of people's quality of life, and being able to align that with all the work we've been doing around outcomes focused assessments and around trying to capture everything about a person's life and where our role fits within that when we're trying to support people.
Yeah, and how would we assist and prepare staff for that different, for this change in focus for inspection? Because traditionally, in preparing for inspection, it might have been more of a focus on our process and procedures that we have in place in a service. An example being our reviews of people's support plans happening frequently enough. But in thinking about that change, might it be more about preparing staff for talking about how they've contributed to this person achieving a significant outcome? If that's to spend, I don't know, for example, real good quality time with family members and contribute to family life, rather than talking inspectors through how they recorded support that week. The conversation is likely going to be more about how have you contributed to that person being included in family life this week. So it's starting, I can see it's going to start to change our role in supporting staff in their own preparation for inspection, because the nature of conversations with inspectors is likely going to be different.